Thank you very much, Yinka. Very kind words. I do appreciate having this opportunity. I was really looking forward to coming to Africa and to Egypt next year. I'm looking forward to that, but I'm very happy to be involved in this virtual colloquium. I can see 124 participants. This is very exciting. I was just reflecting on the many times that I've given this type of talk, and I remember that on 4 occasions I have talked in Africa. Once live, so in person in Mauritius, and 3 times virtually, so into South Africa, into Kenya, and into Ghana. And every time it was very successful. I really enjoyed it. And I know there'll be a lot of countries represented here today. And let me say to you that if you like this talk, and I hope you do, if you find it useful and you would like me to do a dedicated webinar into your university, I'd be very happy to talk to you about that. If I get inundated, then maybe I'll have to ration, but I really do enjoy the opportunity of sharing, I guess, just my experience. I don't think that I've got any wisdom that hasn't come with having grey hair. So when you're a survivor, you learn some tricks, and I want to share those tricks. So as I said, if at the end of this you think that this would be a good talk, for you, your colleagues, or your university, please drop me a line, and I'm sure I can help you out. Yinka, I want to share my screen. Yes, I can do that. And I want to share the right screen. I hope I get this right. I think I will.
Yeah, it's coming on. Here we go.
Okay, so this is the opening slide. I've called it a masterclass on pitching research. I mean, it is about communicating with your research colleague, and for many of you, I think your research colleague will be your mentor or your supervisor. But as Yinka has already mentioned, the talk is largely based on my SSRN paper, and today we'll only have a chance of touching the surface of what this is about. And what I would strongly urge and recommend that you do, if you haven't already done pre-reading, then do yourself a favour, as we would say. It will be well worth your effort. It's free. You can download it from SSRN. And you'll basically have a record that you can refer to, a written record of everything pitching, essentially, from this paper. So I know that I have, I guess, in total about 40 minutes. I'll try and leave some time for Q&A, and I think I will really just stop. I think I'll stop when I think the time has run out. I'll make these slides available to Yinka, and I'm happy for you to share these slides with everyone. And basically, there'll be a lot of content in the slides that we'll rush over, but you'll have an opportunity later, excuse me, to look at it. So in theory, there are 3 goals. I think the 3rd goal, we will run out of time. But the slides have many references, many links that you can click to get examples, to get video examples, to get written work. Mostly we'll spend the time on goal number 1 and goal number 2. So I want to just explain the pitching framework, give you a feel for the underlying philosophy, and then show you an example. So really, for our purposes, it's all about communication. There are other ways that I could explain this to you, but I think this one works really well. And when we're time constrained, communication is obvious. It's central to our entire lives. And when we're thinking of our research, it's absolutely paramount. If we want to embark on any type of research, these days we'll never do it alone. We will never do it alone. Even as PhD students, while it is our work ultimately, we need to be able to communicate efficiently, effectively with our supervisors. So communication is important. And this is the theme that I want to build upon today. Now, in terms of communicating our research, and early on, this is challenging. It's daunting. We are often feeling lost, feeling overwhelmed. There's too much information, and probably we feel scared and embarrassed to openly share information and communicate with our supervisor, the academic expert. So it's a difficult task, and the mistake that I see made more often than any other is that young scholars want to share too much too soon. So what I find is that the communication breaks down because instead of giving a focused amount of brief information, the student or the young scholar swamps the supervisor, the academic expert, with pages and pages and pages, with paragraph after paragraph, and they're hoping for feedback. And what happens is, in my experience, that this fails. It fails because the academic expert can't sift through the information very easily to find where they can give advice. So it's a difficult task, and communication can be improved. So to explain the framework, I'm hoping the technology will work. If it doesn't work, I have a backup plan, but I want to play a 9-minute animation that explains the framework and essentially will provide you with a very powerful and important tool that will improve your communication. Sorry, I've got a few screens I'm looking at here. I've got to make sure. All right, now I'm hoping, Ninka, can you just confirm you can see the YouTube?
Yeah, I can see that. Yes.
Okay, all right.
Hi, I'm Robert Faff, Professor of Finance at the University of Queensland Business School. You'll come to know me as the Pitch Doctor. Researchers make systematic and rigorous inquiry into things. It is immensely rewarding and important work, but definitely not easy. New researchers often have trouble getting started and maintaining focus in a sea of information. Supervisors are there to help, but their time is limited. Wouldn't it be great to have a systematic method for keeping yourself on track and getting the most out of the time you have with your supervisor? The pitch template is designed to distill your idea down to the key elements, making it easier to first clarify your own thinking and then to communicate to others. Identifying and articulating the essential details helps to start a conversation, allowing you and your supervisor to get the most out of the research process. You can also use the pitch template as a way to quickly deconstruct and record the important elements of research articles you are reading. Using the pitch template to reverse engineer the research of others will give you excellent knowledge of the leading approaches in your field. The pitch template is a living document that can and should be updated as you hone your ideas. It is designed to shape your thinking around what is most important and guide you from initial stages to final write-up. Let's take a look at the key areas of your research that are identified and outlined in the pitch template. What is the pitch template? First, your project needs a meaningful classification. Start by providing a working title and some key information on the research problem and background. Your working title will probably change over the life of the project. To start with, think short, 8 words or less, and informative. You can make it seductive and searchable later on. Next, you need a key research question, the overarching question that guides the research. When you are framing a research question, try asking yourself these questions. What is your overarching discipline? Is it finance, marketing, etc.? Start at the top and funnel down through smaller and smaller sub-disciplines to position your problem within a precise area. What is your paradigm? What is the broad field you are positioning your problem in? That is, the philosophical perspective. And what are the underlying assumptions and language required for this paradigm? What is your focus? Are you pursuing a descriptive, predictive, or analytical approach? In the next section of the template, you identify key research papers. Choose the 3 key articles that have most helped you clarify your thinking. These may change across the course of your research project, but it is important to always have an understanding of how you plan to fit your research into the broader literature. Next comes motivation. In this section you explain what are the scholarly factors driving your study. Motivation can come from real-world phenomena, the requirement for a new theory or model, or stakeholder needs. How should I organise my research thoughts? It's as easy as 3, 2, 1. Now that you have defined and positioned your research problem, you need to focus on the key specifics of how the research will be conducted. 3. There are 3 basic building blocks: idea, data, tools. Your idea is a central statement that connects your research question and your motivation, and, if possible or relevant, hints at your central hypothesis. It should be a statement that provides insight into the idea as a whole. Next, you consider your data. When thinking about data, there are 2 areas to contemplate: what you need and what is possible to reasonably access or collect. With data, we can think of it as having a demand side and a supply side. On the demand side, what data do you need to answer your research problem? Is it possible to collect the data you need? What sample will be required? What sample size will be adequate, and what will be desirable? The supply side. What data are available? Is it possible to access? Who needs to supply the data, and is this viable? Are there ethical or other constraints to producing the sample? The data section of the template will help you assess the feasibility of the project, as well as highlighting issues that may need to be worked out with your research mentor before you start your data collection. Tools. Again, think about tools in terms of what you require and what is available. Think of it from the demand and supply side again. Demand side. What tests, tools do you require to answer your problem? Tools can include software programs, materials for data collection, etc. How will you access these tools? Supply side. What tools do you have access to? Are there other people or organisations that could facilitate access to tools that you require? 2. There are 2 key questions. The first question is, what's new? This is your chance to show the novelty of your project and why you're excited about it. Is it the first to achieve something? Does it solve a problem? The second question is, so what? This section is about why the research will be important to others, especially to your academic tribe. Think about the implications for the discipline and key stakeholders in the motivation section. What will change once someone reads your paper? Will they think or act differently? 1. There is one bottom line. The bottom line is contribution. Think broadly about the contribution you are trying to make to the existing research and write an overall statement that encapsulates what you hope to achieve. Other considerations. This section is for any other issues that will have a bearing on your research. What are your target journals for publication? What are the research-related risks? Is it possible someone else is already conducting your research? Are there risks associated with the research process itself, such as ethical concerns or feasibility issues? Finally, think about what role your personal assumptions and expectations could play in the outcome. Avoid designing a test that almost certainly will give you the answer that you desperately want to be true. Your approach should be objectively scientific, that is, open-minded and inquisitive, rather than aiming to confirm your personal faith. Now that we've gone through the pitch template, what can we conclude? First, the pitch template provides a simple and flexible tool to guide you through all important considerations when conceptualising and designing a research project. Second, by taking the time to methodically work through each section and keeping within the guideline of 1,000 words, you will have all your thoughts organised succinctly for a meaningful discussion with your mentor. Remember, less is more, and by using the template, structured less is even more. Third, over time, using the template will make you a more efficient and effective researcher. You'll be able to conceptualise and define aspects of a proposed research project more quickly, giving you confidence. You'll also develop an understanding of your own research strengths and weaknesses. This knowledge will form the basis of your program of skill development. Most importantly, you will be able to optimise the time you have with your research mentor, ensuring each meeting moves your research project meaningfully forward, even when your research mentor is time poor or grumpy. For more information on the pitch template, go to the SSRN and access the latest version of pitching research at the following web address.
Okay, so, whoops.
And also the web portal.
Oh, if I put that over there, hopefully we're back on the PPTs. So,
Yes, we are.
yep, good. So this is the null version of the template. So it's empty, but basically it indicates the simple framework. And I guess one thought that would cross the mind of many is it's super simple, and maybe you could be tempted to think, oh, it's all so obvious. You know, I do that. I do that all the time. Well, I don't believe you. I really don't believe you. If you believe that you cover all these things, my experience is we do it in a very haphazard way, and it takes a lot longer when you start out to actually figure out that all these things matter and are important. So it's all in one place. It's packaged up in a way that I think helps the communication process. And so if you imagine that you're taking the challenge, you're taking the pitching challenge, you've got to populate those blank sections of the template. Now, you don't necessarily start at the top. You don't necessarily start with item A, working title. In fact, I probably think one of the most obvious places to start is actually the second item, item B, the basic research question. And maybe soon after that, probably item D, the motivation. So what I would advise is that it's not a linear path process. It's not one where you start at the top, you work to the bottom, and you finish. So not only is it non-linear, it's dynamic. It should be seen as a dynamic, recursive process. Because what I would argue to you is that as you work through this in whatever order appeals to you, as you add more information in, your thoughts and your ideas evolve. And that's actually a beauty of this. Your ideas evolve, and then you must go back and alter what you've written earlier so that you get a cohesive package. So that when your mentor has a look at what you've written, and they might take quite a linear view, so they might start at working title, then look at the basic research question, the key papers, the motivation or puzzle, the idea, the data, the tools. Think about what you said for what's new, so what? What's your bottom line for contribution? And what have you said about other considerations? So the way in which this is constructed, I think, will be very different to the way in which it's read or consumed. Okay, the construction of this will be very non-linear. If it's a value, it will be recursive and it will be dynamic. So just a few more words about the structure, because I think this is important in terms of how I would advise you to go about completing this. The first 4 items to me go together. They're a package. And they're largely about you setting the scene, about setting the big picture or framing your project. So to me, this is much better if you hover a little bit above the more narrow focus of your project. And if you hover at that big picture level, it's a combination of a little bit about what this area, this broad area of research is about, and mostly about why. Why do people care about this area of research? Okay, now that framing is very important to set the scene as a platform for the rest of the template. And the rest of the template, beginning with the next 3 items as a package, now drill down to the project specifics. So this next package, this subset, what I call the building blocks, are the idea, the data, and the tools. Okay, this is the heart of what it is that you plan to deliver. The idea will have an element of, in many cases, the hypothesis or prediction. The data will be your view of the best data to bring to the idea. Now, this needs to be analysed. What are the tools that are going to analyse it? So those 3 things have to work together. They are the building blocks. They are the heart of your research proposal. But we can go further than that. We can think of the project as having 2 dimensions, and it's around these 2 key questions. So you need to be able to demonstrate in a strong way, in a feasible way, in a meaningful way, in a compelling way, the novelty. What is new about the research that you plan to do? But it's more than that. We can't celebrate if we think this is novel and new. The second question is just as important. It needs to be not only new, but it needs to be something that will be seen to be important. We need to rebut the critique of, so what? So novel and new and important. They are the 2 key questions. But this all leads us to the bottom line. The one thing that we have to sell in a good way, not sell to someone a dud product. We want to sell on the merits, the contribution, that increment to the knowledge base in this field that we think we can offer to the academic community. So there's a natural and I think compelling wedge in this framework, in this design. There's a 4-dimensional piece, a 3-dimensional piece, a 2-dimensional piece, and then the holy grail, the bottom line of contribution. Now, I have other considerations in there as well, just to allow for things that are important and relevant that may not fit in the earlier parts of the template. Now, there's a bunch of slides here. I had no time to go through these. You're welcome to have access to these slides and you can work through and hopefully figure out what many of these pieces of advice are really telling you. For example, I'll just quickly mention one, the key papers. So if we have a look at item 20 on this slide, I suggest that collectively the key papers should persuasively indicate recency. So if you want my advice in terms of selecting key papers, go for recent papers, not old papers. The second piece of advice is go for papers or articles that are written or authored by recognised leaders in the field. And the third piece of advice in item 20 is, other things equal, if you're going for published work, then choose papers in the leading journals in your field. And, you know, for accounting and finance, go for the top three. In finance, it would be Journal of Finance, Journal of Financial Economics, or Review of Financial Studies. And that's quite extreme advice, but what I'm trying to push users of the framework, and on this particular element, the key papers, I'm trying to push you to the frontier of knowledge in this field. And you're more likely to be the frontier of knowledge if you choose papers that are very recent, they're written by leaders in the field, and if they're published in Tier 1 journals. Now, I'll skip over pretty much all of this, perhaps, and I'll try and leave 10 minutes of Q&A, question time later. Some of your questions might ask things that are covered in these slides. But what I want to make time for now is to get ourselves to the position of an example. And the example I've got is neither accounting or finance. So we're all equally disadvantaged. Now the example is actually a health-related one. It's a real pitch that was done by a PhD student 3 years ago, Keris Downing. My guess is Keris has probably graduated with her PhD very recently, but I've lost contact with her. Now, Keris participated in a competition that I run at UQ, except this year. COVID has defeated me and I gave up. But for 5 years previously, right across the university in all fields, and UQ, the University of Queensland, is a comprehensive university. So I have seen pitches in all fields, not just accounting, not just finance, not just business. And Keris was looking at a very interesting area and one that we could all relate to and feel that it's an important area of research, looking at children with hearing difficulties, school-age children with hearing difficulties. And so I have a video, there's a written version of this, but I want to share with you her oral pitch. And her oral pitch will give you a good example of using the pitching framework.
Good afternoon. My name is Keris and I'm also from the HABS faculty, but the School of Health and Rehabilitation Sciences, and I'm here to talk to you about my research entitled Using an Emerging and Innovative Technology, Wideband Acoustic Emittance to Diagnose Conductive Pathologies in School-Aged Children. A hearing loss is caused by pathology anywhere in the ear. Conductive hearing losses are caused by a pathology or a disease of the outer or middle ear. They often go unnoticed, fluctuate in severity, and are most common in children. I'm interested in identifying and diagnosing these pathologies that result in conductive hearing loss. We're going to call them conductive pathologies. So my research question is, are wideband acoustic emittance measures able to diagnose conductive pathologies with greater accuracy than the current clinical standard? So why is this important? Studies report that up to 13% of Australian school children will fail a school hearing test on any given day. And the vast majority of these are due to a conductive pathology. The current clinical standard, conventional tympanometry, is failing to identify conductive pathologies with high accuracy. A new battery of tests, wideband acoustic emittance, has emerged as an objective test of outer and middle ear function, showing preliminary results suggesting that we can improve our ability to diagnose conductive pathologies. So far, small-scale studies have shown promising results regarding the capabilities of wideband acoustic emittance. Wideband measures were shown to be better predictors of conductive hearing loss than the current clinical standard and improved the classification of ears as normal or impaired from 76% up to 96.5% correct. Results have suggested that different conductive pathologies provide a distinct wideband acoustic emittance result pattern. And wideband measures have also been shown to identify otitis media with effusion, a common conductive pathology with high diagnostic accuracy. Conventional 226 Hz tympanometry is a quick and objective test of middle ear function. It uses a 226 Hz pure tone to measure the oral acoustic admittance, or how much sound flows into the middle ear. However, its capabilities are limited. This test can only identify two factors: the presence of fluid behind the eardrum, or, if there's no fluid, the air pressure of the middle ear cavity. So currently in clinics nationally and internationally, the accepted standard can only identify a conductive pathology if there is a measurable change in the middle ear's ability to absorb and transmit a 226 Hz pure tone within these two parameters. The auditory system is built to perceive a huge array of frequencies. Conductive pathologies can also affect the middle ear's ability to function across this range of frequencies, not just those at or around 226 Hz. Wideband acoustic emittance measures are a family of physical measures that assess middle ear function using a wideband signal. So this is a signal using frequencies from 226 Hz up to 8,000. It also has the ability to detect changes in middle ear function across this range. It captures the same data as conventional tympanometry, which is that yellow dotted line there, or can be compared to that yellow dotted line there, but for all frequencies in this range. It is hypothesized that wideband acoustic emittance measures will identify conductive pathologies in school-aged children with high predictive accuracy, upwards of 90%, that they will have greater predictive accuracy than the current clinical standard in this population, and that wideband measures will accurately differentiate between specific conductive pathologies in school-aged children. To address these hypotheses, data will be collected cross-sectionally from two sets of participants. Participants from the normative data set will be recruited from students undergoing hearing assessments in Brisbane schools, and participants for the clinical data set will be recruited from patients of the audiology and ENT departments at Ipswich Hospital. All participants will undergo a comprehensive audiological test battery with changes to test protocol depending on the environment. Wideband measures will be retrieved from all participants. And participants will be included in the normative data set if they pass their hearing test provided at their school, and participants will be included in our clinical data set if they have been diagnosed with a conductive pathology by an ENT surgeon. So the results of our 226 Hz tympanometry and our wideband tests are our dependent variables and will be compared based on a clinically acceptable gold standard, and that's the diagnosis by the ENT surgeon. Age, gender, ear, ethnicity, and presence and degree of conductive hearing loss will act as an independent variable for all of our outcome measures. Small amounts of missing data are expected to occur, as is common when working with paediatric populations, but these are not expected to have any effect on our data analysis. To reach a satisfactory level of specificity and sensitivity for these tests, we need to have data from 562 ears to achieve a power of 80% and with a 5% significance level of significance. And this will be achieved by running a school hearing program for 3 years. All testing equipment is either on-site at Ipswich Hospital and UQ, or is transportable and calibrated prior to testing. The personnel performing these tests will be qualified audiologists or audiology students under direct supervision. The sensitivity, I missed a bit. The statistical analysis area under the ROC curve will be used to evaluate the diagnostic accuracy of the wideband and conventional measures. The two tests can then be directly compared. Sensitivity, specificity, and likelihood ratio predictors will be calculated to further compare the performance of each test. So what's new? This study will directly compare the diagnostic accuracy of current clinical practices against this new wideband measures at identifying conductive pathologies in school-aged children. We will also use the wideband measures to diagnose the pathologies in school-aged children, which is an entirely new concept within the literature. But so what? Diagnostic accuracy is of utmost importance for best clinical practice, and the current clinical practices are not diagnosing conductive pathologies with sufficient accuracy. This study will provide critical information regarding the diagnostic accuracy of our conventional methods versus the diagnostic accuracy of an innovative technology. If the hypotheses are correct, there is potential justification to replace 226 Hz tympanometry with wideband acoustic emittance measures to improve clinical practice and in turn optimize audiological care. Additionally, if conductive pathologies are able to be diagnosed in this manner, then children will not have to undergo surgical and invasive procedures just to get a diagnosis. Direct comparison of the diagnostic accuracy of these two measures for identifying conductive pathologies in children is a novel concept, and as such, this study will fill a prominent gap in the literature. Findings from the study also have the potential to inform future research processes by allowing more accurate evaluation of middle ear function. Ethical clearance for this project has already been attained. It's a low-risk project, and all of the tests are routinely performed in health settings around the world.
Righty, I think in the interest of time, I'll just cut Keris off there because I'd like to leave some minutes for Q&A. So I think, Yinka, I predicted I would stop,
Yep.
and I think we have all the background that we need, and
Yes.
I'm keen to see whether we have any questions from the audience.
Right, so please, we can take one or two. What I'll be doing after this is to share Professor Robert Faff's website and his Twitter handle so you can follow to get more resources. I see he's already tweeted something on our Twitter page, so you can, Twitter handle, you can also look that up. Because the next session starts 10 on the dot, and chairs of those rooms may be thinking about setting out to go. But I'm happy to take one or two questions. So if you want to ask Professor Faff a question, just raise up your hand or give me the digital hand raising symbol and I'll know. Or you can type something into the chat. I'll see if there's one there. Right, I think basically we're getting questions around how to pass across your resources, Prof. So you intend to give us the slides, or would you want us to just refer people to your website? Which one would be more effective?
I will send you the slides, Yinka, and I think the slides have a lot of links in them in terms of the resources. So I think anyone that wants to get a good sort of way of accessing the resources can look at the slides. Of course, the go-to is to get the paper off SSRN, the main paper. The other thing is if anyone wants to contact me directly, my email address is easy to find. And as I've already said, I'm very keen if there are participants who would like to discuss me giving a webinar for them, their colleagues at their university, I'd be happy to do that as well.
Right, thank you so much. Somebody was asking, Professor Faff, how do you gauge whether your pitch is suitable for 1-star, 2-star, 3-star, all those sort of journals? I'm sure this is typical the ABS ranking because we use the ABDC here.
Yes. Look, it's a good question. It's very difficult to answer. I think my go-to would be when it gets to the part of the template that is around the novelty, the so what, and the contribution, it's really, and it's a judgment thing. There's not a quantitative thing that I can say to you, but a mentor will know whether they're convinced, whether there's a convincing story around the novelty and the so what question. So, for example, where something can go a little badly as far as the novelty, we can easily get focused on talking about novelty in a very superficial or trivial way, and so this will often happen when we do single country studies. So I know myself, for me, I was born in Australia, I live in Australia, I teach in Australia, I work in Australia, so I would, for most of my studies, choose Australia. And a mistake that you can make is to say, well, it's never been done in Australia before. And that is a superficial argument around novelty. Because what can often happen is someone who wants to critique you will come back and say, but it has been done in 20 other countries or 10 other countries. So it has to be more than it hasn't been done in a particular setting before. It has to be more than a trivial novelty answer. And if it is deemed to be that superficial level, it's likely you're only really going to be able to target a 1-star or maybe 2-star. It's if you can be much more ambitious about what the true novelty is around more the concept rather than the application to a particular setting. That's only one example. It's impossible to give you a quick answer to that one, but it's a good question.
All right, I think that's the much we can take. What I'll do is, if you've got more questions, if you leave them in the chat, or I would recommend you follow Professor Faff on Twitter. He's very active. I'm also following him there. You can get more resources about all he's been talking about. And once the slides come through, all registered participants will get them from the Secretariat. Thank you once more, Professor Faff. I think, like we said, this is the tip of the iceberg. We would see more of this in Egypt next year. Right, Professor Teven, you want to say something before we leave this session?
Just to say thank you very much, Professor. We're very, very grateful for your, I think our comments are very positive from across for your insights. So I can just echo Yinka's words. Let's hope we can properly see you again in Egypt next year.
Thank you very much. I look forward to it, and I wish everyone a great success with the conference and the colloquium. And I'm really looking forward to having the opportunity to turn up next year in person, and certainly before then I'll be happy to interact with many of the participants this year. So good luck, Yinka. I'm about to send you this PPT deck right now, and please share it with everyone. Thank you. Thank you,
everyone. Just before you leave this room, remember to follow the AAF handle. It's association, AAF Association, and my handle, Yinka K. Moses, for all the updates on this colloquium. So cheers for the next session. Please, you can start going into your own rooms, and we'll join you there shortly. Thank you, everyone, and I'll see you again shortly.
Bye. I'm going to send those PowerPoints right now. Bye-bye. Bye.